Welcome to the Mental Transformation YouTube channel. A panic attack occurs when our mind sends a false alarm, even though there is no real danger. It can feel like you're having a heart attack or losing control, and it's a deeply distressing experience for those who go through it. During an attack, life can feel unbearable, and even in moments without an attack, the constant fear of having one looms over, making daily life a struggle. People who experience panic attacks often find themselves trapped in a vicious cycle of anxiety and dread, constantly anticipating the next episode, which only heightens their overall anxiety. Panic attacks typically come on suddenly and involve intense physical and emotional symptoms. Some of the most common symptoms include a racing heart, chest pain, shortness of breath, dizziness, trembling, sweating, and a sense of impending doom. These attacks can happen at any time, and they don't always have a clear trigger. For some, they may occur in specific situations like crowded places, while for others, they seem to come out of nowhere. One of the most challenging aspects of panic attacks is the unpredictability. Since they can happen at any time and in any situation, it leads to a sense of loss of control. The fear of experiencing a panic attack can even lead to a condition known as agoraphobia, where a person begins to avoid certain places or situations, fearing they might trigger an attack. This can severely limit their daily life and activities. Many people who experience panic attacks also deal with a deep sense of shame or embarrassment. Since the symptoms can be very visible, such as sweating or shaking, those who suffer from panic attacks may feel self-conscious about having an episode in public. This often leads to isolation, as they may avoid social interactions or public spaces altogether. However, it's important to remember that panic attacks are a common mental health condition, and there's no reason to feel ashamed. The exact cause of panic attacks is not entirely understood, but it's believed to be a combination of genetic, psychological, and environmental factors. Stressful life events, such as losing a loved one, going through a major life transition, or experiencing trauma, can trigger panic attacks. Additionally, there is a link between panic attacks and certain personality traits, such as being more prone to anxiety or having a tendency to suppress emotions. Despite how overwhelming and debilitating panic attacks can be, there are effective treatments available. Cognitive behavioral therapy, CBT, is one of the most successful approaches to treating panic attacks. CBT helps individuals identify and change negative thought patterns that contribute to their anxiety. Through this therapy, people learn to challenge their fears and develop healthier responses to anxiety-provoking situations. Exposure therapy is another approach that can be helpful for those dealing with panic attacks, particularly if they have developed agoraphobia. In exposure therapy, the individual is gradually exposed to the situations or places that trigger their anxiety in a controlled and safe manner. Over time, this helps reduce the fear and avoidance behaviors associated with panic attacks. Medications, such as antidepressants and benzodiazepines, are also commonly used to help manage panic attacks. These medications can help reduce the severity of the attacks and decrease the overall frequency. However, it's important to note that medication is typically most effective when used in conjunction with therapy. Lifestyle changes can also play a significant role in managing panic attacks. Regular physical exercise, adequate sleep, and a balanced diet all contribute to better mental health and can help reduce the likelihood of experiencing an attack. Additionally, practicing relaxation techniques such as deep breathing, mindfulness, and meditation can help calm the mind and body during moments of anxiety. One of the most important things to remember when dealing with panic attacks is that you are not alone. Millions of people around the world experience panic attacks, and help is available. Reaching out to a mental health professional is often the first step toward recovery. With the right treatment plan, it's entirely possible to reduce or even eliminate panic attacks and regain a sense of control over your life. It's also essential to build a strong support system. Friends, family, and support groups can provide much-needed encouragement and understanding during difficult times. Sometimes, simply talking about what you're going through with someone who understands can help alleviate the burden of anxiety. In conclusion, while panic attacks can be incredibly challenging to deal with, They are a treatable condition. By seeking professional help, adopting healthy coping strategies, and building a support network, those who suffer from panic attacks can find relief and begin to live a life that is no longer dictated by fear and anxiety. Remember, there's no shame in asking for help, and with the right tools, it is possible to overcome panic attacks and lead a fulfilling life. Thank you for watching the video. Don't forget to like the video, subscribe to the channel, and leave your thoughts in the comments section.